everybody. We're going to get started here in just a couple minutes. I do want to make sure that you are able to see the handouts in the chat in the handout function. And we're going to use the chat box for you to ask questions or chat with us. All right, you guys ready to get started? Well, welcome everybody to today's webinar. We're talking about discovering a new standard of care with seca body composition and inHealth health coaching. And I am lucky to have two fabulous presenters with me today. So I think the three of us can really talk to you in great detail about what our new partnership is all about and how you can really grow and scale your practice and extend your reach and improve outcomes, as well as getting a pretty nice return on investment. So I'm Dr. Nina Crowley. I'm seca's Director of Clinical Education and Partnerships, and I am excited to be here with Dr. Michelle Alencar and Andrea Wilson.
Hi, everyone. Thanks for having us. Thanks for joining us this morning. Dr. Michelle Alencar with inHealth. I'm our Chief Science Officer, one of the co-founders. Thrilled to be here to just go into a little bit deeper of what we're all doing together with seca. So thank you for joining.
Hi there, I'm Andrea Wilson. I'm with inHealth. I am our account manager. I also do some health coaching. Great to be here today and great to have this partnership with seca as well to help with those outcomes of our patients.
Great. So what we're going to talk to you about today, I'm going to get started here. We're going to talk a little bit about this partnership that we've been referencing. And if you're part of our network, hopefully you've seen this through some emails and some messaging. This really was a labor of love that kind of has come out of conversations that Michelle and I have had at a lot of the obesity care meetings and how we can really work together to solve some of the pain points that we were hearing in our healthcare providers. We're going to talk about the current culture, climate, and trends, which has been fast moving in the field of obesity care and chronic health disease lately. We're going to talk about how this program is implemented and what it really looks like and kind of take you step by step. And then we're going to talk about the impact on practice revenue, which is super exciting, and then talk through some case examples to show you what that looks like in real life. So I'm going to turn it over to Michelle to get you started about the power of partnerships.
Yes, so this is a powerful partnership. And what we've done is we have combined two evidence-based components to build this comprehensive obesity approach. It's the both and approach. So essentially what we're doing is we're bringing lifestyle coaching plus gold standard body composition analyses to ensure that patients have the tools that they need to be successful. And so what we're doing in our combination therapy is bringing our full suite of lifestyle coaching programs on the inHealth side, which we boast a academy to keep our coaches gold standard, lots of things that we will delve into more later. But essentially what we're doing is we're supporting and elevating the results that we're obtaining, not only from the seca's body composition results, but also with your care plan. And so the integration here is the sweet spot that we feel this partnership is going to really be a benefit to you, your patients, and your practice. So here are the benefits of lifestyle coaching, this counseling component that really is sometimes often overlooked. And so let's be honest, behavior change is really hard. We've been doing the behaviors that, we've been doing for our entire lives. It's complex, it's nuanced, it's difficult to drive behavior change. So when you're telling a patient that they need to not only, improve their diet, they need to increase their physical activity, this all becomes very overwhelming at times to an individual. And so enforcing and supporting behavior change is something that is a skill, and it's something that coaches really will go into a very unique offering in order to ensure that it's very personalized. And so oftentimes as providers, we have limited time and skills to facilitate this behavior change process. It takes a lot of handholding. And as we've known, when we've gone through our own behavior change in our lives, it takes time, it takes repetition, it takes accountability. And so when you're trying to scale a practice, this may not be something that you have time for. And that's where we can come into play to support. And lastly, it's about individualization, for frequency, intensity of follow-ups, accountability, support. All of these components are very individualized. Every individual that you have and all of your patients you can tell from your medical visits, as an example, how different everyone is. And from a behavior change standpoint, it also requires a lot of individualization. And so the coach that we are going to be outlining our process today is really that person that handholds the follow-up, provides the accountability, and really supports that patient from an end-to-end perspective of your extension of the care plan. So what we want to do is do a little poll with our audience here, and we want to essentially ask you a few questions. And I think this will help us as panelists to just make this information very real to you and make it applicable. So if you don't mind, we're going to launch a poll, and please respond. And we'll give everybody just a moment or so to finish the poll. And really encouraging you, if there's something else, write it in the chat. We want to talk about it.
Okay, you've got 30% said improved outcomes, 20% said more time to spend with patients, 50% said all of the above.
All right, so it sounds like we've got a good split across outcomes, spend more time with patients, but yeah, our goal today is to show you how all of the above are benefits to your practice. Okay, next question. What factor gets in the way of you scaling your practice? We'll give a few more moments here.
That close that one for you. You've got 25% said cost, 25% said something else, and 50% said time.
All right, sounds like time is the leader, and we will talk about that more in detail. But yes, all of those are barriers that we've identified and we'll be able to support with this partnership. So first off, we want to highlight, before we delve into your responses and how they integrate here, want to talk about the benefits of incorporating body composition analyses. Body composition analyses will help an individual and a provider set realistic and individualized goals, essentially using more than just BMI, using more than just the scale number. These are individualized goals that support an individual to look at their body composition as a whole. And so we'll look at those metrics in a little bit. It'll also help us target treatment, medication dosage, frequency, intensity of follow-ups. All of those things are incorporated into how you can use the different outputs that you're receiving. And essentially, if you're not measuring it, you won't know the quality of weight loss until you measure it. There's a large body of evidence out there in the research that shows that, essentially with rapid weight loss, that's where you can get into a little bit of trouble in terms of the quality of weight that we're losing. And so if you're not measuring it, we won't know what we're doing there in terms of quality. And essentially it'll help us prioritize early intervention for low muscle mass. And that's key when we're starting to talk about the integration with lifestyle coaching, which can include discussions around nutrition as well as physical activity. And for what we have today, we want to really highlight this comprehensive solution. So the partnership that inHealth brings with seca is to bring that component together. So the majority of you said time was a factor, and here is your solution potentially to help give you some more time with your patients doing the medical side. And so what we do on the inHealth side is we provide evidence-based board-certified health and wellness coaches. As I mentioned earlier, we have an academy that prepares our coaches to sit for the National Board of Health and Wellness Coaches, credentials, same oversight as many medical degrees as well. Our program aligns with the seca device results. Our coaches are seasoned to interpret and help educate around the results that they're obtaining from the device. And lastly, it's a reimbursable program through commercial as well as Medicare payers. And so you can help to drive significant practice revenue. We also, of course, support cash-based programs as well. And so really this comprehensive solution is really giving you the option to have an in-office body composition analysis performed and then reviewed by a health coach. So saving time with the interpretation, with your staff's interpretation of those results. Let the coach support you on that. Using the gold standard and certified coaches provides an extension of your practice, an extension of the care plan. So if you're using those results to, for example, adjust medications, and it's important for your patients to adhere to that, our coaches are there to support and help them integrate and ensure that they're staying compliant with your care plan for medications, as an example. The added support for patients with chronic conditions for true behavior change. When you talk about individuals and behavior change, it's even more difficult at times for individuals with chronic conditions to make those lifestyle changes. And so this added support is really helpful. There's no needed to have overhead. There's no added staffing. That's the beauty of the inHealth offering, is we take all of that off your plate and really just deliver a gold standard coach to be able to drive and discuss, those key lifestyle change perspectives and discussions. And like I said, it's commercial and Medicare claims-based coaching, which means more revenue to your practice, which we'll talk more about those numbers in a few slides. What I'll do next is I'm going to turn it back over to Nina to talk about culture and climate trends.
All right. Well, thank you. And somebody let me know chat's not working, but the questions pane is. So if you can find that in all of your little drop downs there, you can ask us a question in there and we'll be able to answer it. So yes, I'm going to talk a little bit about the interesting changing times that we are in right now, which has been really great. I've been in the field as a dietitian and program coordinator for a bariatric program for a long time. And there was a lot of years where we had a big gap in care and not a lot of new things coming out. So it's been really exciting the past couple of years to be in this place where we're seeing a lot of new options, a lot more collaboration, and in this realm, a lot more metrics that we can actually use to help people with their behavior change. So I'm going to talk through these three areas: the comprehensive full spectrum care, the interdisciplinary care teams that address complex conditions, and then our actionable outcome metrics that matter to you and to the patient. So as far as comprehensive care goes, we know that we're talking about, not just obesity, but, complex health conditions that really do require full spectrum care. And so you hear a lot of people talking about comprehensive care. What does that mean? There's a lot of new and different programs popping up that are, aiming to help take care of patients in one way or another. And so kind of from that both and approach, I know we talk a lot about that. There's going to be a lot of different ways that people get their care. So I don't think there's going to be a one size fits all program that meets all the patients everywhere's needs. And so we've got to really think about how to piece some of these things together. The coaches really do support patients from a holistic approach. So from nutrition, physical activity, behavior, lifestyle, all of those areas that you as a provider may or may not be able to offer in your program, you can be assured that the coach approach is really dealing with that from a full holistic approach. It's also important that we're all addressing and understanding all of the obesity treatments and recommendations. So that's these days hard to keep up with more medications than we've had in the past. But we're really going from nutrition, exercise, physical activity, lifestyle-based recommendations through surgical treatment. And so all of those approaches, especially these days, are not just one bucket where you're either or, having one of these measures. There's crossover. You may be a surgical patient who's taking medication afterwards. You may be a long-time nutrition lifestyle patient who then tries a medication. And so it's important that we all are able to address all of those areas for our patients. And then comprehensive care really is also including body composition analysis, because it's really becoming important and critical to most all of our providers that we're looking beyond weight and BMI. I know that's been a factor for patients for a long time. And, as providers, some have been using this for a long time, but I do believe pretty strongly that it's part of the comprehensive approach if we're giving people realistic goals, and we're not, telling people, hey, lose this much weight and everything changes. We're really working on this from a holistic approach. And so that includes looking at factors other than just their weight. From an interdisciplinary perspective, we know that you can't do it all alone. So, one of the places where I learn a lot about what's going on in our community is through some of the Facebook groups where healthcare providers go to talk about, help and issues and collaborate with one another. And I think a few years ago in that group, there were a lot of providers who were able to offer kind of a comprehensive approach, but in one almost, like you could do it all. It's a one-stop shop. You had enough time to talk to patients about nutrition and physical activity and behavior. But now with the range of medication options available, the surgical options, and all of these things that are available, it's rare that someone can do it all in one. And so for a lot of providers, you talked about costs and time. And so this is where I think it's really exciting how the inHealth team is able to provide the coaches as an extension of your in-person team. So, they work with you to learn your philosophy and how you do your work and extend that to the patients that they're seeing from a virtual coaching perspective. It's also really hard to keep up to date with all of the obesity care treatment options and counseling that's going on. It's not for people who have not been in the obesity field very long and who are starting to provide medication. I think at first people are they're doing great on the meds maybe, and they're having really, good success. But as I can tell you from someone who worked in bariatric surgery for so long, the long-term approach to caring for their weight and their weight health long term, there's a lot of different things that come up. And so it's after that beginning phase of that rapid weight loss, it can be difficult in very different ways. So I think it's important to have folks on the team that can address all of that. And then of course, communication. So Andrea and Michelle are going to talk a little bit more about, how the coach approach works for communication. I think they've done a really great job figuring out how this works from how much information do you need? How often, how many touch points do you guys need to have? And then what information do you need to feedback with the team? So I think that's great. And that's why, for the body composition side, we're wanting to plug that in to be one of the things that this interdisciplinary care team is talking to patients about, but in a model that's been working for them and they've been successful in their approach for a while now. So we didn't want to recreate the wheel. We just wanted to both and the approach. And finally, the actionable outcomes. Again, you've heard this. I know those of you who've been in the field have been living this for years, that, we want our patients to look beyond weight, BMI. We've said that. I know in my program with bariatric surgery, I said that for years, but I also didn't have the tools necessarily to be able to practice that. So we're now able to focus on metrics that connect what we're talking about for change to results. Excuse me. Also, the motivation for long-term change, excuse me, really is best when the data is personal, relevant, and connected to something they can see. So we'll talk a little bit more about the body composition component, but it really is a fantastic way for patients to see the efforts of what they've been doing from a real personal approach. Excuse me. Finally, focusing on reducing body fat mass while retaining lean muscle during the weight loss journey. This has been a really big topic. And again, we're talking a lot about obesity care here because that is where we do have a lot of clients. But we're also talking about all different chronic disease models. So the same medications that we're talking about for obesity care, we're also talking about in diabetes. And now we're talking about in cardiology. And I anticipate all sorts of different types of clinics and types of patients. So we're really talking about a comprehensive approach here. But we're all looking at, are these medications or surgery or nutrition lifestyle programs reducing the weight by losing too much lean mass while we're aiming to reduce the fat mass? And the good thing about our world is that I don't know which of those treatment options is the best or loses the least lean mass. All my, kind of push is that we're measuring it so that we can actually say, okay, this person's not losing any lean mass. This person's losing too much, and be able to tweak your treatment approach to that, person's actual response to that. So when we started talking about how are we going to offer a program that meets the needs of our clients, our mutual clients, we really started to listen to what you guys are saying. So these are some quotes and kind of some areas that we've heard where people understand the importance of interdisciplinary care, but they may not have a budget for adding a dietitian, a psychologist, a exercise professional, but they have a need and they get it. Some people have a body composition device, but they really don't know how to integrate it. They don't know how to explain the results. They don't have time to really get into it with their clients or their patients. Some don't have enough time to go through all the results, and that's a big part of it. And then some are really focused on growing the practice or really meeting the need, the demand for all the patients that are wanting to see you. And so, it's kind of hard to balance that with a really long appointment time to address some of these needs that are coming up. So based on this, we can say, the challenges that we're looking at, I'm sure you guys, if you, kind of could think about them globally, would say most of the challenges fall in these categories with overhead costs. If you're in charge of your practice, staffing to scale, recruiting quality staff who are into this approach and who are good at it, the administrative burdens across the board, declining reimbursement rates for some of these components, and limited time spent with patients, meeting patients' expectations for what they need and what they actually need to do well long term. And then the attrition of patients who may, drop off if they're not staying engaged. Or I remember in my practice, we in downtown Charleston, it take a while for people to get there to park and get in the clinic and go through all of the, clinical backflows. And by the time they got in the room, if they only were in there for 5 minutes, and it's like, oh, hey, yeah, we got your weight. You're doing great. Anything going wrong? No. Okay. See you next time. They don't come back for those kind of visits because that wasn't really a value add for them. So I also really love that we're able to address some of the kind of blend of the in-person and the virtual care in this model as well. So our program, jointly is really going to address these three key factors: the cost, the time, and the understanding or the education about, in particular, lifestyle change and body composition results. So reducing the administrative burden of staff by, Michelle will talk through this, and Andrea as well, as, having the coaches be the people that are providing this, but it's on a kind of pay as you go model. So if you have fewer patients that need it, you have fewer costs associated with the staff from the inHealth coach side. They know the insurance and billing. That was a huge part of, in my bariatric world, to figure that out. And so they have figured this out and know how to do this and can really take that part off your plate. Scaling as you grow, and then you generate reimbursement with their reimbursement model. So I'm really excited for Michelle to talk through that in a minute. And then time, these medical visits do take time. I know, from the body composition perspectives, people say, well, I only have a few minutes. I don't know if, the measurement itself is going to take less than a minute, but how about the counseling around it? So we're taking that part off your plate. They're going to provide the results counseling, and that's virtual. So it doesn't have to be taking, the time in the office where resources may be a little limited on that end too. And operating at the top of your scope of practice. I think that's a big one. We really want to be making sure that if you have a certain amount of patients, you're able to do what you need to do. And then the other folks who are trained and have time to do that in their realm are able to do that as well. And then finally, understanding, as Michelle said, certified coaches. They do have a fantastic program. The continuing education is there. This has really expanded a lot over the past 10 years as far as what I've seen in the coach realm. They're trained on our results. So I work with the team to make sure they understand the results and how to communicate that to clients. It's not as easy as it sounds. There's a lot of factors to consider when, you're looking at someone's fat and muscle changes, their body water, their weight changes, and why are things moving in this direction, and how can we give people feedback about that to move them in the right direction and kind of connect that with the behavior change approach. And finally, your patients are getting the evidence-based coaching and the behavior change support, and they're staying up to date with all of the different models that we have now. So Andrea is going to talk us through what it looks like, because I know we've talked a lot about kind of the benefits and what we can get out of it, but I really want you to see sort of the nitty-gritty of the process and the flow of what this actually looks like.
Thanks, Nina. So I'm going to talk a little bit about the implementation and support. In office, you're conducting the seca body comp measurements, and you're introducing inHealth lifestyle coaching to the patients while they're in clinic. A referral or an order is sent to inHealth via your EMR with the seca data. And then the health coach is going to review the data and your care plan. The coach will call, text, get the patient scheduled to begin their coaching journey. And once they've been scheduled, we will verify that their insurance is active. Our coach will complete the virtual health coaching session. We'll complete chart notes, which are going to include goal setting, behavior change, as well as interpretation of those seca results. And then we're going to upload those to a secure SharePoint site, or we'll fax them to you via your EMR. Additionally, we're going to send weekly super bills. Your billing team will input the data for reimbursements. We will provide some concierge billing support as well. And we're going to connect on a monthly basis just to make sure reimbursements are going through. And also if there's any denials, we can help work those as well. So now let's talk a little bit about what the body comp results and what our coaching team is doing together. So the image on the side of the screen is depicting 6 of the 19 parameters available on the seca body composition device. And health coaches are going to focus on BMI, the body composition chart, talking about fat and muscle. We're also going to be talking about the fat mass percentage, skeletal muscle mass, percent water ratios, along with resting and total energy expenditures. Let's connect these a little bit closer with behavior change. So we've talked about the limitations related to BMI. We know weight alone and BMI are not sufficient measures and assessments of health, since it's not measuring body composition or overall health. So there's no distinction between that fat, muscle, or water. So when we measure the body composition, it allows a more comprehensive approach to health and access adiposity. We're going to also talk about the body composition chart, where it's combining fat mass and skeletal muscle mass. It's helpful to visualize body composition changes over time. It's beneficial for weight loss when fat mass is lost, and we're able to see a move down on that chart. Health coaches are going to help guide patients based on your care plan to maintain and or increase that muscle mass and provide education on patients on the benefits to health and weight loss of incremental muscle mass. Of increased muscle mass. We're also going to be monitoring body fat percentage. It's a valuable tool for assessing the effectiveness of interventions or treatments for weight loss. Coaches are working with and educating patients to reduce that body fat and maintain or increase the muscle mass. We're working towards healthier body comp and overall well-being. Coaches are meeting the patients where they are, setting goals and action steps to help drive change. Let's talk a little bit about the results related to behavior change with preserving lean muscle mass, energy expenditure, and also the water ratios. So we all know nutrition and exercise are crucial parts of weight loss. Skeletal muscle mass parameter is a very important piece to help ensure that that muscle mass is maintained. Coaches are going to provide education and guidance through to the patient with behaviors to help preserve that lean muscle mass through diet and exercise. As muscle mass increases, so does our resting energy expenditure. The seca device is going to, and the results are going to help provide coaches with that REE and the TEE to help guide the patients in discussions related to macronutrients to help promote the weight loss and muscle mass maintenance. We're going to use the water ratio and the distribution of fluids to help detect edema and provide better ideas of weight loss situations where great amounts of weight are lost initially when starting a diet. When we combine the accurate body composition data and personalized coaching, it's going to lead to better health outcomes. Patients are more motivated, they're engaged, and they're likely to follow through with the provider's care plan, which is resulting in improved health and satisfaction. Coaches are going to help continue those conversations you had in clinic with your patients related to their care plans and their clinical goals. We're going to use some motivational interviewing, as well as other coaching techniques to help guide your patients and shift their lifestyles to help incorporate behaviors to improve those outcomes. Coaches and patients together are going to co-create goals and lifestyle plans to help drive that change. So when we combine the body composition and the personalized coaching, patients do have better health outcomes. Our research has shown that. After 12 weeks of coaching, patients have lost nearly 8% of their body weight and 22 pounds in 3 to 6 months. There's a higher adherence, almost 92% adherence to the use of the body comp tools, and with 60% engagement with visits at 6 months. Now I'll turn it back over to Michelle to talk about the impact on practice revenue.
So here is the exciting part. When we dig into what this means from a practice perspective, it can be very compelling to start to implement the seca plus inHealth offering. What we wanted to do when we first started our partnership was support providers in helping to monetize their devices. What it really has blossomed into is something where you can generate six figures in the first year by implementing this program. What we do is by enrolling just as little as 20 patients per month, you can actually generate on average $114,000 per year. But this is all based on patients only doing 2 visits per month. When we start with patients going through 4 visits a month, they go to biweekly at 12 weeks and monthly at the remaining. So on average, 2 visits per month, where we see our national average of our reimbursements per visit around $85. This could be more or less in your region, but essentially just enrolling as little as 20 patients per month can generate this level of revenue. So not only will it drive practice-based revenue, it will help with your device sales. It'll help to bring immediate revenue and value to the practice by leaning into your seca device and the value and the data that it presents. Whether you're cash-based or reimbursable, these coaching services are going to add recurring revenue streams to your practice. And that's where we can customize things if you're cash-based to ensure that you're driving a good ROI. So when patients are doing, their frequency of visits, and this is where you come in as a provider to prescribe the coaching service, this is where you'll start to see the great adherence measures that Andrea just outlined. So together, we create this powerful income stream by using the body composition device and the coaching service. So let's dig in a little bit deeper. What you see on your screen is an example of a dashboard that our team on the inHealth side will have for your practice. So we wanted to share just a single provider practice back from 2013 and different claims data that was, that we were using from a just single provider practice. This is actually a bariatric practice, just as an example. If we're starting from the very far left-hand side of the screen, this provider was able to do 4,430 visits year to date. When we look at how much they were paying, our invoices is that middle column. How many payments they received was over $300,000 year to date. When you look at profit margins in this particular provider, they were able to generate close to $140,000 in profit with a good profit margin of 45%. And this isn't even including all the claims for that particular calendar year. What you'll also see on the bottom side of the screen are the different codes that we use and the different reimbursements that we see by code, as well as the payers who are your leaders. So this gives you a nice little snapshot of what it looks like in terms of how much revenue can be done by a single provider practice. If you have multiple providers in your practice, you can just do the multiplication. So overall, what you can see in that particular example was, over $300,000 in revenue last year alone, $140,000 in profit. But not only that, when we talk about revenue, we're also talking about how are the patients perceiving this service. So we also deliver monthly assessments through surveys to patients to ensure that they are enjoying and seeing the value in the service that you're providing. Essentially, you'll see here on this particular provider that we were highlighting, same practice, the NPS score or how good they were feeling the service was a 56, which is in the great category for NPS. For this particular provider practice, these patients are seeing their coach, on a very frequent basis. They are seeing the value of their experience from a nutritional perspective, seeing how they're increasing their physical activity, and they're really, truly enjoying the experience that they have with their coach. So just as a reminder, it's not just about revenue, it's also about patient satisfaction and making our providers and their practices the hero. Our coaches, again, are an extension of your practice. We want them to come back to you excited about their progress. And that's what their coach is going to sort of ignite, is their, empowerment to drive their health forward. So the next slide, there's some questions that we often receive, which is, well, what about with our seca device? And I'll let our seca team jump in as well. But, these are just some ideas of how you can monetize your seca device on a cost per measurement as well. So on the coaching side, it's very compelling, but you can also lean into that on the seca side. And these are just a handful of practices on how much they charge as an example for the seca measurement alone and the value that's around that. So of course, it varies based on practice and needs and those kinds of things, but know that there's also an opportunity for you to charge for those assessments as well.
Perfect. You handled that one great. And this is just really, we do get this question a lot. So this is just what's published on people's websites that I was able to grab, but we really do see a range from including it in the comprehensive program, whether that be an insurance-based program or something that's charged for at the outset, or some do cost per measurement. I also see sometimes the packages where people are charging a initial fee and then getting follow-ups free. I've also seen get the initial free because we want baseline information on folks before they start a treatment plan, and then maybe charge depending on frequency. And some of this we'll talk through a lot of this usually individually, but it depends on how frequently people are getting measured. But we don't recommend measuring any more frequently than about 4 to 6 weeks, because what you're wanting to assess with body composition is change in body composition. So if someone's getting on there too frequently, you're going to just see some noise in the measurement, and behaviorally that takes people down a whole different rabbit hole. So we would want to make sure that we're not doing it any more frequently than monthly.
Thanks, Nina. All right, so let's just highlight a case example and also what the patient and the coach interaction looks like. So it is a telemedicine-based interaction through video on our commercial side and phone through our Medicare side, or video on that side as well. But you can see that it is a very personal one-on-one experience. And so we're highlighting a patient. His name is Ben. What he experiences when he reaches his coach for the first time is really just motivational interviewing and really understanding his unique case. What the coach is also doing on the back end is looking at your care plan, your needs for that patient from a lifestyle perspective, and really understanding how that intertwines into Ben's, unique experience in his lifestyle. So they're talking about lifestyle. They're also assessing quality of life. So at various frequencies, our coaches are deploying an assessment that looks at overall quality of life that's related to physical, mental, emotional well-being. And so you're truly getting a nice improvement, if you will, in overall quality of life as they go through the program. They review tenets of success, so nutrition, physical activity, stress, and sleep. Those are at the forefront of the discussions of the coach, but tailored to the individual and their unique circumstance. And really, they're that coach to help navigate, what does success look like? How do I do this in my lifestyle? I don't eat this. How do I find another option? Those are all the pieces that the coach is there to help guide and support. And they also help the patient on the right-hand side. You can see getting set up. So it's multiple touch points. It's that high frequency interaction, as I mentioned earlier, weekly visits to bi-weekly to monthly as they progress through their journey. They can message with their coach. They can connect different health devices. And, really during that initial first few visits, they help the patient understand what's the program structure and why are we doing it like this? And really, it's because of the foundation of research and the body of evidence that shows, that the individual needs multiple touch points. So they help to navigate, this is a lifestyle change program. This isn't something that's acute. We're here to support and guide you. All right. So staying engaged is key. A lot of individuals can get started, but it's hard to stay engaged. And so there's different app tools that are available to them, recipes. If you would like to use our meal plans, we can always ingest your meal plans as well. So there's interactive tools within, the library for the patient. This is where they can also interact with any of their data as well as patient education. And so, there's a robust offering to be able to give digital tools for success for patients. And that's what their coach is there to help to guide and support them. And then, of course, the phases are on the left-hand side, which is what I was describing. So here's Ben, just, looking at him as an example, but there's millions of patients like Ben. At inHealth, we've touched tens of thousands of lives, and we're very proud of it. And so as an example, Ben, for example, is down 145 pounds in 19 months without usage of anti-obesity medications in his case. But really, we don't know his body composition change. And this is where the beauty of our partnership is. We would love to start working with motivated providers like yourself to truly show the impact that would have been for individuals like Ben. And so we're excited to have this partnership to show the body composition change and maybe the impact it would have had additionally to his health parameters. For Ben, as an example, he started with a hemoglobin A1C of 12%, went down to 5.1%. He went from 12 medications to 2, and he continues to be an inHealth patient to support his accountability and motivation to maintenance. And one key piece from his testimonial that I love is he said, lifestyle change is more than a diet. If you make your wellness a priority, this program gives you useful tools to make the journey easier. And that's really what our coaches are here to instill. They're instilling empowerment for that individual to make and prioritize the change that they want in their life. And ultimately, our providers become the hero in that relationship.